There is constant debate about multivitamins, if they protect us against cancer or if they increase risk of cancers. We will discuss this issue. Another, if we require vitamins at all, and if we intake multivitamins. First, if person has proved deficiency of vitamins, then he or she requires multivitamin complex. That's first. Second, if woman is capable of pregnancy or she is pregnant, she requires folic acid or vitamin B9. Third, if infant is on breastfeed or partially breastfeed, this infant requires vitamin D supplementation. So we have these three most important indications. First, if person has deficiency and inadequate diet. First. Second, if person is pregnant. Third, if infant is on breastfeed. Now let's say evidence-based benefits of multivitamins. There is important studies about age-related macular degeneration or AMD. Age-related macular degeneration is #1 cause of blindness in United States, and risk increases with age. And multivitamins, especially rich with antioxidants such as A, E, D vitamins and minerals such as zinc and coprum, decreases risk of age-related macular degeneration by 25%. In this study, people intake this high dosage of antioxidants and multivitamins for 11 years. Another, about cancer. There is several studies and they are controversial. We have several studies in which multivitamins decrease risk of cancer. For example, according to one meta-analysis, multivitamins decrease risk of cancer 8%. So 8% total cancer incidence is decreased. And such people intake Centrum, its multivitamins from Pfizer, for 11 years. Another study, there was 37% of reduction in total cancer incidence among men. We should notice that cancer risk reduction is more prominent in men than in women. Another study, reduction in mortality was 30% when men intake multivitamins for years. And possible explanation is the antioxidant action, DNA repair, and folic acid is responsible on DNA repair, and immune system, improved immune system functions. Many vitamins help it, and minerals also, including zinc, is important. And hormonal balance, vitamin D is important for hormonal balance also. But we have other studies. According to this, there was 0% effectiveness in reduction of cancer incidence. So there is some studies which indicates that multivitamins can reduce risk of cancer. We have some studies which says that there is no difference, and we also have some studies that they can increase risk, especially if a person intakes multivitamins more than 10 years, but this increased risk is very smaller. And there is some studies that high level beta carotene or vitamin A increase risk of lung cancers in smokers, for example. And we have such findings, but this increased risk actually is not high. So to say as a conclusion about cancers, personally I think that it's not, I think, benefits slightly more than potential harm. It's my personal opinion, and I think it's worth to intake vitamins, and I personally intake. I think, according to my judgment, it's worth. So I personally intake, but I can't recommend that intake or not to intake. It's your personal decision. But my opinion is this: because potential benefit is higher than potential harm for me. Of course, I'm not sure on it, but what I see, we have studies with positive results, studies with negative results, and studies with no difference. But I think that in some point they may help. Also, we have several studies. According to this, multivitamins reduce risk of Alzheimer's disease. These people there was study about among physicians. They intake multivitamins for 20 years, and they had 23 reduced risk compared to placebo group. So it was double-blind study. Part of people, physicians intake placebo, part of physicians intake multivitamins, and there was difference in Alzheimer's disease. And possible explanation is antioxidant activity and reduced homocysteine level. That's all I wanted to say about multivitamins. If we assess and say as a conclusion, I think anyway potential benefits is high and important, and it's worth. Maybe not to intake, for example, every day for 10 years, but some periods of year. For example, when person intake less vegetables and fruits, if there is no season, for example, maybe it's worth to intake multivitamins. And also, I think it's important, especially if person has deficiency for multivitamins, especially in teenagers, if their diet is not adequate. But you should assess this diet first, and then make decision if person needs multivitamins or not. Thank you for your interest. Thank you for your watching. If you like my videos, please thumbs up. If you like my channel, please subscribe. Thank you very much. Bye for now.